I was like 13 years old, and I started my first period at a football game. And I went home and I was like, Mom, my stomach hurts. There's stuff in my pants, like all this weird stuff is happening. And she said, oh, honey, that's your period. She never talked to me about having a period before. Like, no one ever said, one day you're gonna start bleeding. No one did that.
I do remember my first period, and my mom and my sister were not like, it's not like they like sat me down and had a talk with me beforehand or something, but like, I had an older sister who was 3 years older. My mom was not like hiding the fact of when she was or wasn't on her period.
I started my period when I was 8 years old. There was like no one around me that like was, and I just thought there was something wrong with me. I was actually someone who, and still do, struggle with endometriosis and have from an early age. And so I was recommended by a doctor like to help regulate my periods to actually get on birth control. You always just think about it as something that women have to do to protect themselves.
I have a large population under the age of 21. I would say maybe 30% of what I see. Planned pregnancies is maybe only a couple percent.
In my ideal world, right, we all have access to like a lot of different kinds of healing and health-related support, and a lot of that isn't in the communities where I've lived here, but has been in places I've lived outside the region, in big cities, or places where there's a lot more money, where that you can get all this other kind of naturopathic or acupuncture, or like, there's just so many options out there that we really don't have access to a lot here.
I think that in being a woman in Appalachia, there are several stereotypes that you face when wanting to obtain birth control, especially at a young age. Some women are still under the assumption that you have to have your parents' permission if you're under the age of 21, which isn't true. Some people have the stereotype that if you are seeking birth control, that it makes you means that you are more promiscuous.
I definitely think that there's a particular lack of general healthcare access, period, for anyone, particularly for people who are LGBTQ women. We all deserve a right to our own specialty healthcare. We're all different people with unique needs, and I can't even imagine it's just all the layers adding on of, why people in healthcare systems make excuses about why they can't serve us when there's too many resources that aren't specifically being created to serve us. And so it's just infuriating.
Welcome to History Alive on WMMT Mountain Community Radio.
I think, like so many things, right, there just aren't as many options here as a lot of other places. And even our healthcare systems are doing a whole lot with a little bit of funding. And so it can be hard to find what you need, or to find consistent healthcare that's like timely or affordable, I think, for anybody here. And then when you get into sort of specialty things rather than just a checkup, like I think a lot of people have to drive really far to find the care that they need if they're able. Most people aren't able, so it's like you got what you got here, and a lot of times it's not it's not the same as what people have access to elsewhere, right? Just having lived in Texas and Massachusetts and North Carolina and seen sort of different types of hospitals, different types of like healthcare setups, like people here have a lot less options.
In general, healthcare it's always been a struggle in this area. We don't have as many resources. We don't have as many physicians or other health professionals. I think transportation is a big issue. I think that there are a lot of people that don't have access because they don't have a way to get to a clinic. They don't have money. They don't have support. We can't we may not be able to provide as many things as some of the larger communities.
I think there's definitely, lots of particular stereotypes around like who are the type of LGBTQ people that are here, or like there's sort of a stereotype that everyone that is, going to be successful leaves, which I think is a general stereotype about young people in the region as well.
Not only in Appalachia, but in a lot of places in the South, like the tension between religion and queerness is just really present, right? And it's a like daily navigation for a lot of queer folks here. There's really little things that healthcare providers can do that go like such a long ways towards making queer people feel like comfortable, if not safe. That's maybe takes a little more work, but definitely at least starting with comfortable, right? And so sometimes it comes down to even just like the intake forms, or even just like the basic question at your initial appointment around like, are you sexually active, is often where this comes up, right? And like, it doesn't take much for there to be a second step that's not like, are you sexually active? As it is, like most of the time when I go to the doctor, the questions are you sexually active? If you say yes, then they're like, cool, are you using birth control? And then you kind of have to be like, I mean, right, you could just say no, but then they're going to think you're being like, I don't know, unresponsible. I think there's some simple things around how questions are asked, like, that can be shifted in terms of just acknowledging that like sex and sexually active don't mean the same things for everyone, and that every time that queer folks have to like explain that like it actually makes you feel like the healthcare system doesn't think that like your life, your body, what you're doing with it, your pleasure is like the right way. Whether or not your actual doctor feels that way, like that's what it results in.
So I go back in the back to start talking to the doctor, and we're sitting down, and he's like, so you're here for birth control? Yes. Can you tell me about the implant? He said, you can't get the implant. Well, why not? He said, the implant is for people that can't swallow pills. You can swallow the pill. So I said, well, I was on a patch for years. He said, I know. I said, can I get back on a patch? He said, no. The patch and the implant are for people that cannot swallow pills. You can swallow a pill, so you will get the pill. I said, I don't want the pill. I can't remember it. He said, you have to train your mind. You have to make yourself remember. So instead of giving me the patch, forget the implant, I don't even want to know about it anymore. Just give me my patch back. And he said, no. Do you want the pill or not? I don't want to leave there without birth control. This man heard me, heard what I wanted and what I needed, completely ignored it, and gave me whatever he thought I needed, not what I knew that I needed. Although you're a doctor, I know my body too. I got the pill and I started it, and about 3 or 4 days in, I absolutely hated my life. Like, I hated my life. I had the worst mood swings. I had thoughts that I haven't had in years, like terrible, terrible thoughts. And I did not want to get out of bed. Like, everything was not okay. So I had to go to another doctor in Whitesburg, at a clinic in Whitesburg, and she prescribed me my patch back.
I had a really, really great primary care doctor when I lived in Whitesburg, but she was like super honest with me about the fact that she did not, have like training or like knew or was able to prescribe things to me in terms of my hormones, but she was willing to educate herself and learn. And like because I was her patient and she was my doctor, and it's that simple. And she, you know, cared about me and wanted to make sure that I had the access to the best health care for my situation. So I really appreciated her.
I think to me there's like in some ways like a simple solution, which is to like have healthcare providers have a little bit more education around like gender, around sexuality, around like different reproductive systems and body types that like queer folks might be interacting with, and to not just assume that if you're sexually active it means you could be pregnant. Beyond that, a lot of shifts to be made around gender, to like ask folks what gender pronouns they prefer. Sometimes like I'm not strongly identified with the rainbow as a symbol, but like having things in a waiting room or on a door, or like even if there's like a pamphlet on the wall in the room where you are, can like do a lot to make someone feel like, okay, they might know a little bit about this, and not have sort of like your defenses up that I'm gonna have to like navigate this with this person again while I have no idea whether or not they think it's like morally or religiously wrong, and I really just want to get this like healthcare thing taken care of, you know? I feel like sometimes we oversimplify like LGBT to mean like one set of experiences, and I think it's actually really a lot more varied, and that people across different kind of identities have really different experiences.
You know, I think that there's a huge privilege that we have being from this place, if we are able to feel the connection that we do with our place and understand the importance of our region to the world, and how we get to have this like beautifully like messed up sometimes, but like really you know, particular experience. And it's not always sunshine and rainbows, but I think that it's worth it overall.